All right, today I am here with Rochelle Clark from the Art of Healing Touch, and she is an expert in lymph. And I am going to have her just explain to us what the lymph is and everything that you need to know about it. So, Rochelle, thank you so much for being here. And would you briefly tell us how you got started working with the lymph?
Oh, I would love to. And thank you for inviting me to be on your podcast. I really was looking forward to this. So I'm thrilled to be here with you today. That's a really interesting story because my training was, I had extensive training in shiatsu and before I even started massage school. So I imagined myself doing shiatsu, deep tissue, and medical massage. And I didn't really have the patience for lymphatic in massage school. So I learned never to say never. And I have one of my clients to thank for nudging me into lymphatic arena. We'll call her Nancy, but she was one of my first clients. And then Nancy developed breast cancer and she developed lymphedema because of the surgery and everything she had to go through. And we were in the Seattle area at the time, and she had to drive about an hour to find somebody who she liked that could do the lymphatic drainage for her and reroute the lymph. And she was a registered nurse, and she kept saying, Rochelle, you really should explore lymphatic drainage. We need more people in this area that know how to do it. And I thought, no, maybe. Well, she wouldn't let up. So eventually I saw a course by Diana Kincaid in Seattle, who was well known at the time. And I was actually the first student to go through her certification course. So the first class that I went to, the first 4-day segment of the certification, I walked in and I fell in love with it. She was working on a client or a student that had a huge bruise on her hip. And just with a very gentle work that you do with the lymph, I could see it changing color around the edges and the swelling was decreasing. So
Oh, wow.
I thought there really is something to this. And so I enrolled in her course and stopped the cranial sacral certification that I was currently in at the time and went with lymph. And so I was her first student. Diana Kincaid was amazing, and she was a mentor of mine for a long time. The only missing piece from her training was she didn't offer the complete decongestive therapy that you need to work with lymphedema. So in 2010, I went through Close Training LLC and got that additional piece and just phased out medical massage. And now all I do is lymphatic drainage and breast massage.
Oh, that's so fascinating. I love hearing that story. So, can you explain to us the basics of how the lymph system works and kind of why it's important?
Yeah, that's a really good question. And I get asked that a lot. There's so many different ways to dive into that topic, but the lymphatic system really is a sister system to your blood system, but the blood system is closed and not able to expand to take up extra fluid. Whereas the lymphatic system has a very extensive network through the body with lymphatic vessels and lymph nodes and lymphatic organs. And it's an open system, meaning it pulls additional waste and fluids and cycles them through, filters it, and ends up in the blood system again. And the lymphatic system has the ability to expand to handle that extra fluid in certain areas. And so it has the lymphatic vessels that pick up debris and proteins from the interstitial fluid around all the cells in your body. And once it enters the vessels, it's lymph fluid. And then you have your lymph nodes, which are your little checkpoints or filtering stations. And they are, depending on who you talk to, the experts, they're saying 700 to 900 lymph nodes or 12 to 1500 lymph nodes. But the bottom line is you have a lot of lymph nodes and a lot of little checkpoints in your body, your surveillance system. So most of those are in your abdomen, and a lot of them are in your neck, around your neck and above and below your collarbone and around the breast tissue. And in all the soft folds of the body, like your armpits, your groin, behind your knees, and around your elbows, and up around the neck and the occipital lymph nodes. So you have a lot of little lymph nodes filtering and working hard. And then you have your lymphatic organs. So your tonsils and adenoids are your first surveillance points for pathogens entering your body. And you've got your spleen and your thymus here, where your T cells mature. You have your Peyer's patches in your intestines, your appendix. So the lymphatic system, so you have all these things working, and most people don't realize that it's your silent sewer system. It's working hard to get all the toxins out of your body. It also is really important for maintaining fluid balance in the body. So, the experts say that it's only responsible for 10% of the fluid management, but if it's not working properly, you're in trouble. So, it's really important to have a healthy lymphatic system working well. So it maintains fluid, it removes waste, and it also distributes nutrients throughout your body to all your cells. And that's something that's not really talked about very much.
Oh yeah. It's the whole system is not talked about. It's like this, oh yeah, the other thing we don't really talk about it. And I think your image of the silent sewer is brilliant because that captures what it's doing and how kind of covert it is and how, I think we can all identify with if the sewer is back up, we got a big problem, but yet when they're running well, we don't even notice them. We take them completely for granted, which I think is a really great analogy.
Mhm. It is. And I still remember, so many years ago, one of the first massage therapists that I went to for a session before I had even gone to massage school. And he said, you have so much. He goes, you're so tight here. He goes, your lymph isn't able to move here. Your cells are basically bathing in toxic waste. And I'm like, oh my, that doesn't sound very good at all. So, and that it's interesting the things that you remember. So that image has stuck with me all these years.
That's a great image. And it's literally what's true, but we don't think about it. And this is why lymph is so, so important.
Mhm.
So, Rochelle, most people that might be listening to this have heard about lymph and the lymph nodes specifically. And there's a lot of discussion in breast cancer circles, especially, but about removing the lymph nodes. Let's
Mhm.
just dive in here and talk about this because this is kind of controversial and really confusing for a lot of people. So, why would cancer be in the lymph nodes? And is it even a good idea to remove them?
That's a great question. And yes, it's very controversial. You know, People think that cancer just travels easily throughout the body, but the reality is cancer has to undergo certain enzymatic and chemical and protein changes before it can start moving around in the body. And if your lymph is working healthy, your lymphatic system should be able to eradicate those cancer cells. So what happens is those chemical changes happen and well, let me back up. You have so many lymph nodes around the breast tissue. In the breast tissue, above the breast tissue, there's a chain of lymph nodes above the breast and around the lateral breast, and then it goes into the axillary lymph nodes in the armpit. Once it starts to travel to the lymph nodes, they do remove lymph nodes for staging purposes. Now, it depends on if you're going holistically or standard of care, but personally, I've seen what it does to my clients when they start removing lymph nodes and you start getting the disruption in the lymphatic system and you develop swelling in the arm, on the affected side, and even into the upper quadrant of that side. So it's a very personal choice. I understand that. But, the lymph nodes, the cancer cells can get trapped in the lymph nodes and it can start to grow in the lymph nodes. But it also depends on what you're doing to treat yourself. Uh, but those lymph nodes actually are full of immune cells that try to destroy the cancer. So The question is, do you or don't you? And I'm not one to say what to do. I meet my clients where they're at because, like I said, it's a very personal choice. But those lymph nodes, again, are your surveillance system. And a lot of times they can eradicate the cancer themselves as long as you're working with someone like Katrina, a health coach, to help you navigate this because it can be very scary. And I do understand that. Does that answer your question?
That was a fantastic answer. Yeah, because it is a very personal choice. But I think it's important for people to understand that the cancer being in the lymph nodes isn't necessarily a bad thing. Like that's your body's system and way of dealing with it. And that's where you want it to be in some regards. And the way that those white blood cells that you're talking about are there to address these issues is really key to understand. And then the other aspect you touched on about how there are side effects of taking them out. A lot of times, most of the clients I talk to, the surgeons don't really talk about this, and people don't realize. And they'll say things like, "Wow, I didn't understand what it was life was going to be like after this."
Mhm.
And it's so fascinating because I remember during cadaver work that, I mean, they are so small. I can't even explain how shocked I was to try to find them. And they're so, so tiny, but they're designed to be there. And having them not there, like the edema and stuff you're talking about, it changes the whole terrain of how your body functions. And that's something to take into consideration.
That's true. It's a major disruption to the lymphatic system. And, they may only remove one or two lymph nodes. They call them the sentinel lymph nodes for dissection or biopsy, whatever you want to call it. But there's a specific chain of flow for the lymph in that area. And, I've had clients with 33 lymph nodes removed. They have pretty severe lymphedema, and it's a lifetime issue. I've had clients that have one lymph node removed and they develop lymphedema. So, not everyone does, but you're always at risk. And so, that's something to be aware of and do your research and gain knowledge about, what that how that might affect you
Yeah.
later on.
Yeah. It's good to just inform consent, know what you're going into.
Right.
So you also hear problems about the lymph system after mastectomies. Can you talk a little bit more about what's happening? Is it the same kind of an issue? Is there anything you can do about this when the lymph, whether it's the lymph nodes or just the lymph in general, is disrupted?
Yeah, it's a major disruption to the lymphatic system. As I mentioned earlier, you have a lot of lymph in the breast tissue itself and on the chest wall. And, there's disruption to the lymphatic system after any surgery, but after a mastectomy, it seems to be even more traumatic to the area because you're removing lymph nodes, you're removing lymphatic vessels, you're removing a lot of that fatty tissue in the breast that has other lymph nodes and vessels in it. And you're removing the breast tissue, you get the scar tissue on the chest wall. If they do radiation, you have even more scar tissue and contraction happening. And the lymph nodes, the removal of lymph nodes in the axillary region, just about every client that I've worked with has gone through that, with breast cancer. And they do have swelling in the arm and the upper quadrant on the affected side. So it's very disruptive. You really need to work with a trained lymphatic therapist who understands that you cannot try to route the fluid to the axillary region because obviously it's not able to handle the extra fluid because you have the fluid backing up in the arm. So you have to know to reroute it to the other side and also down to the groin on the affected side. So you really need to work with somebody who understands the four components of complete decongestive therapy, of the bandaging, the lymphatic drainage, the exercises, and the skincare, because you're also at risk for infection. The lymph isn't moving, it's stagnant. And if you get an insect bite or a scratch while you're out gardening and maybe your rose bushes, you get a scratch, you have to disinfect and be careful immediately because you can get an infection easily on that side.
Oh, that's fascinating. Really good information to know because I would guess that's probably not talked about with from the surgeon and such. Is that
Correct, although I'm pleased to hear that I'm hearing from some of my clients and more of the surgeons are on board with being a little more communicative about the possible side effects.
oh, good? That's good to hear. So you've talked a lot about this in terms of why the lymph is so important, specifically with cancer. Is there anything else that you want to share with us, especially like for those that are addressing things naturally and or those that are doing standard of care? How can we support the lymph and why is this so critical? Any other aspects you want to mention?
Well, I always recommend working with a certified lymphatic therapist because you really want your lymphatic system to be functioning optimally, whether it's holistic care or standard of care with Western treatments. But especially for holistic, you want to make sure your lymphatics, it's your surveillance system. You want to make sure it's functioning optimally, work with a coach like Katrina because you also need a nutrient dense diet, whether you're going holistic or standard of care, and she can guide you through that. So that you want your lymphatic system to function so it delivers those nutrients to all the cells, fights the cancer cells, maintains fluid balance, and gets the toxins out of your body. Because when those cancer cells start dying, you do have some toxins in there that you want to remove. And regardless, it's not just the cancer cells, it's the world we live in today. So
Yes.
it's really easy for the lymphatic system to become overwhelmed. And as far as standard of care, again, work with the certified lymphatic therapist who can help you manage the swelling. I know that oftentimes for the lymph system, they're monitoring it more for potential metastasis. And you also want to make sure you can manage the fluid, any swelling that's happening after surgery. You want to get the chemotherapy drugs moving out of your body. And if you've had radiation, you definitely want somebody to do scar tissue remediation on that area after it's healed, much later down the road. But, I use a massage cupping with a meta cupping machine it's had tremendous results for women for their range of motion with that contracted tissue. So there are things you can do. And do you want me to suggest natural things they can do besides working with a therapist?
Sure, yeah. We'll
What?
take any resources you got.
Well, one of my favorites is dry skin brushing. And I have had a lot of clients tell me that yoga, things like yoga and Pilates really help with, that's the remedial exercise with complete decongestive therapy. But just moving your body, since the lymphatic system doesn't have a pump like the blood system does, it gets its movement encouraged through deep belly breathing, dry skin brushing, exercising. And certainly if you've been through cancer treatment, you're not going to be out training for a triathlon, but you can find those gentle restorative yoga, work with a physical therapist that understands and can guide you through some exercises to move your lymph. But you want to be stretching and moving. A little mini rebounder is very helpful. Some of my clients rave about their little vibration plates that they get to keep the lymph moving. So those are just some tips you can do. And I could also demonstrate some things to open up your lymphatic system. But I also have a video on YouTube or my website that's very thorough on how to open up your lymphatic system at the neck. So if you'd like that resource, perhaps Katrina could share my website link.
Absolutely. Yes, we would love that. Okay, so there's a whole bunch there to unpack. So I just want to back up and just really highlight because she dropped some huge nuggets of gold in there. So in terms of healing and everything, that lymph system is going to be super important with natural healing and addressing it, not only because you want to make sure that any way you're healing, you get all the nutrition in, but getting the toxins out. So that lymph system is cleaning and clearing it out, that sewer system. And then did you hear her say that it's getting those dying tumor cells out? Like this is super key. I've had so many people ask me about my cancer, because I didn't have surgery, but my body was able to clear the entire golf ball out. And this is the pathways that it used. So again, if my lymph had been sluggish, if things weren't exiting properly fast enough, it could have gotten backed up and had more problems. And so this is why I really wanted to bring Rochelle in to, show us and talk about this, because it's something that's not talked about enough and it's really key. And then I just want to mention, with the standard of care, when you're taking some of these drugs and things that, they would count as some of the toxins she's talking about in terms of getting them out, along with some of the things that we're testing for and discussing in terms of heavy metals and the chemicals and the mold. Like that is a key, that your lymph pathways are open and flowing if you want to get rid of some of those, so that they're not giving you extra symptoms. That's enormous. So you just threw so much out there, so condensed. I love it.
And I just thought of one more thing too.
Yeah.
It's really, I have so many clients that don't like to drink water, but what they don't realize is if you're not well hydrated, your lymphatic system is sludge. It gets, and people ask me, can you feel my lymph? It's like, yes, it feels really sticky. You don't feel very hydrated. Your tissues feel dry. And so that makes for a very sluggish lymphatic system, and it's not going to be working in your favor.
Yeah. Yeah. And I love that you said that, because we've been talking about hydration a lot, and it's like the cheap and easy thing that no one does.
Right. I know.
Yeah. It's a big one. Okay. So I have a question, and this has always just been something that I've been curious about. So when people talk about lymph, they talk about dry brushing.
Mm-hmm.
And I've always kind of been curious, because physiologically, I don't quite understand. So maybe you can explain it to me, but why does it have to be dry? Can you do like a dry brushing or, loofah or something in the shower, and would it be the same? What's the difference?
Well, the difference is when you're doing dry skin brushing, you don't want to slide over the skin. You want to gently stretch the skin. And if the skin is wet with soap, you're just going to be slipping and sliding over the skin, and you're not going to have the same effect, because with the lymph system, you need to gently stretch the skin. And when it releases, so when you're stretching the skin, the fluid goes into the lymphatic vessels. And when you release it, it's in there. So it's like this. So and I love the way one of my instructors explained it, is imagine flaps, little flaps, and each little segment in the lymphatic system, in the initial vessels, not the thoracic duct that have the valves, but so you stretch the skin. Each little flap has an anchoring filament that's on the filament and your skin. You stretch the skin, the flaps open, you release, it's closed. And so that's pumping the fluid into the lymphatic system. Does that give you a visual of how?
Yes.
So dry skin brushing, very gently. You don't have to use a lot of force, although it feels good if you want to really exfoliate. But to get the benefit of lymphatic, you don't need a lot of pressure. And if you want to use a loofah in the shower, it feels really great, but it's a different outcome.
Thank you. That has been something I've been curious about for a long time. And that completely makes sense, because you're slipping, and if it's wet and such, that totally makes sense. Okay. So you had mentioned this, but could you give us a little demonstration of how people can support their lymph at home?
Sure. So take my sweater off, so it'll be a little easier to demonstrate.
Yeah.
My apology for this.
Beautiful color shirt. I love it.
Thank you. Blue's my color. It's
Yeah.
very relaxing. So at the base of the neck, you have this triangle here. You have your collarbone in your neck, and you have your trapezius back here. And you can just put your finger pads, not fingertips, here, and just do some circles. And pretty soon you should start to feel yourself wanting to swallow. I do this every day, so my lymphatic system is primed. It's used to this. And you can do as many of these as you want to.
Can I ask a question really quick?
Sure.
Okay, so I think people might be asking, you hear a lot of times when people are doing lymph stuff and dry brushing that you start at the ends. Can you talk about why you're starting in the center? Because I love this.
Oh, absolutely. Always start at the neck. Every session starts with the neck. And that is because your lymphatic system empties right here at the base of the neck into your subclavian veins at the brachiocephalic juncture. That's a tongue twister. And so with the lymphatic system, it doesn't have a pump. You have to create space for the fluid to flow to. So if you start at your fingertips and just start moving up your arm, there's not going to be any space for the fluid to flow to. So you really need to create that space, and it creates a vacuum effect. I've oftentimes worked on clients starting on their neck and they can feel their toes tingle. And that is how dramatic it can feel for some people. So
I love that.
So let's even it out and do both sides here. And you can do 10 to 15 of these. Some people do 25 to 50. They really want to, it's a great way to start draining your sinuses. And then you go up here right behind your ear. You have this nice sternocleidomastoid muscle here. And just lay your finger pads across that and do a gentle effleurage stroke down to the collarbone, right to the corner there. And that gets all those lymph nodes in your neck there.
And how hard do we need to push?
Oh, you don't. You just barely want to stretch the skin. So you're gently placing your hand on the skin, and it should feel just a little bit of a tug on the skin. You're not going into the muscle tissue at all.
Okay.
Yeah.
Yeah, I think when people hear massage, they're thinking muscles a lot of times. So I love that you clarified for us.
Yeah, I've had a lot of people say, oh, you can go deeper than that. And I say, yes, I could. Then I wouldn't be doing lymphatic.
Oh, you're so funny.
And then the next one is you have lymph nodes in front, your pre and retro auricular lymph nodes in front of and behind your ears. So you do the Spock move here, live long and prosper, and you just do little circles. So you're moving your fingers don't even slide, you're just moving your ear around and you're stimulating those lymph nodes. And you should feel your lymph moving down your throat.
Yeah.
Mm-hmm. So that's the neck. So I always spend a lot of time on the neck for my clients. And to stimulate all those lymph nodes in the abdomen, you can do some deep belly breathing, or deep belly laughter is great. But that deep belly breathing, and just focus on that abdominal breath. So you're taking a deep breath. And on the exhale, you're really focusing those muscles to really get all the air out. So you're pressing on those lymph nodes. And you can also do a little abdominal massage across the top, just a little pressure back and forth. I don't know if you can see what I'm doing.
Oh, perfect.
You can just, especially on the left side, you have your cisterna and your thoracic duct comes up the left side of your body. You can just do a little bit of, little circles here. You could even go on the other side and do it.
And you do that at the same time that you are taking the big deep breaths?
No, it's a little bit harder
Separate?
yes.
Okay.
Separate. And then you can do little circles in your armpits.
Oh, yeah.
10 to 15 of those, and you do those on both sides. And I have a nice soft dry skin brush, so I'm doing my armpits every day. I'm just getting in here and doing a little, with the dry skin brush too before I do my arms.
Okay.
And that's more effective. And then the last area to really focus on would be, let's see if I can get this.
Perfect.
The crease of your leg, right where your leg bends, and you've got a little divot in there. It's rich with lymph nodes, your inguinal lymph nodes. We call them stationary circles. So you can do stationary circles there on both sides. And something that I learned as well is just mimicking cycling on a bike also stimulates these inguinal lymph nodes. And then you have lymph nodes behind your knees. Those are important to get as well. So you can just do some circles behind your knees, and you've hit all the major 6 points to stimulate your lymphatic system.
I love that. Can I do both my knees at the same time?
You can. Yes.
I'm all about multitasking.
Yeah.
Oh, and this is so simple. So I think sometimes we hear and see things and it gets so technical and where exactly and how exactly, but you just made that so deliciously simple. And we can just do that while we're doing other daily tasks or talking to
Absolutely.
someone?
I'll be stopped at a traffic light and we'll say, "Oh, I'll do a little lip work on my neck," you know? I've got
I
about
love that.
2 minutes at the traffic light here. I can get my neck lymph nodes opened up. So yeah, you can multitask and do it. Just keep one hand on the wheel when you're driving.
Yeah, just not while you're driving.
Yeah.
I love that. Okay, so thank you, Rochelle. Could you just in closing give us some information about like why and when it's good to get a professional like yourself to do the lymph drainage and like what that would do for you and most of all like how to find that person?
That's a really good question. Usually Mr. Google's a great starting point. For someone in your area, if they know how to market themselves well, they'll have a website. And if it just mentions lymphatic drainage, you'll have to really interview them and make sure they've had complete decongestive therapy training. Uh, but you can also go to the closetrainingllc.com website and search for a trained practitioner in your area. Times for, I work with a lot of post-surgical clients, and it's really important actually to have a session before to
Oh,
prep your body. And I've been told that it makes the surgery go easier and the recovery a little faster. So prepping the body with 2 to 3 sessions before surgery, and also as soon as you can after surgery to help with the swelling, decrease the edema that happens, to help support the healing process so you'll have a much faster recovery and less pain and swelling. So I work with all different kinds of surgeries, orthopedic surgery, breast cancer clients, you know, uh, elective surgeries. I do a lot of that as well. Mommy makeovers, tummy tucks. And again, you have to reroute the lymph because that scar across the abdomen creates a blockage for the lymph. So you have to route it up to the lymph nodes in the armpits. I do a lot of detox. So I work with a lot of clients working with someone like Katrina, and they're recommending to go get lymphatic drainage for the detox. And so their lymphatic system works more efficiently. So I do that a lot and they feel better because they're getting the toxins out. I work with also a lot of autoimmune cases. So autoimmune digestive issues, chronic fatigue, fibromyalgia. And it just, it's interesting how much of an effect the lymphatic system has on these conditions. So just about everyone I work with has very positive results. The ones that don't are not really eating a healthy diet and not really following recommendations. So, but yeah, I think everybody in the world should get a lymphatic drainage massage, actually, a minimum once a quarter, but preferably once a month, just for wellness purposes.
which makes sense because we have been inundated with so many chemicals and toxins way more than any time in the history of the world. It's just harder on our system to get this out. And this is our sewer system, right?
Right.
Okay, so when you go to get a lymphatic drainage session, what should you expect afterwards?
Oh, that's a really good question. Well, when you go in, wear loose clothing and be well hydrated, and do not eat a heavy meal because they will be pressing on your abdomen and won't be very comfortable. And it's also a burden on the lymphatic system to eat a heavy meal and then have a session.
Mm.
After the session, that is there's a full spectrum of what could happen. So most often I hear my clients go home and they just hit a wall energetically. They're so exhausted, they can't stay awake. And that's a sign that the toxins are moving through the body. It's overrun and they're tired. Some people have headaches. Some people get a little nauseous. I had one client in the 21+ years I've been practicing lymphatic that actually vomited after her session. And I thought, oh my goodness, she'll never come back. But she did. And the second time was much easier on her system. So, and then I've had clients that feel like they have the flu for 2 or 3 days. Most often, though, they're just tired for 24 to 48 hours and they feel better afterwards. I have had a few clients that say they felt so energized and fantastic the next day after the session and just were bouncing off the walls with so much energy. So I always, oh, and you can also have increased urine output. That's a good sign. You're getting rid of a lot of toxins in water. You may have foul smelling urine or strong odor, increased bowel movements. Some clients start sweating, which is great. Your lymphatic system is working hard to get the toxins out through other means, through your skin. So, does that answer your question?
Yeah, that's beautiful. And I know for me, when I've had sessions, I get tired. And it's usually like the second day, not the same day. So I was just curious what other people have happened, because it's nice to know what those things would be so that when you experience them, you're not like kind of shocked, or
Right.
you don't have plans, the second day after, that are high energy that you're not up for, or something like that.
Yeah, I always try to give them a little idea of what they might experience. So,
That's
yeah.
perfect. Well, thank you so much, Rochelle. And can you just tell us a little bit about where people can find you? And I'm definitely going to link that video, but any other ways that we can connect with you?
Well, yes, I am on Instagram, LinkedIn, Facebook, and my business name is The Art. It's the in front of it, The Art of Healing Touch. My website, and I am in Coeur d'Alene, Idaho. So I used to be in Seattle, but I moved back here where I grew up 3 years ago. So if you're in North Idaho, you're welcome to come see me. And yeah, that's how you can find me. And
Wonderful.
Katrina, I think, will post a link to my
Yes.
website.
Yes, I will post all that. Thank you so much. I really appreciate you sharing this with us.
It was my pleasure to be here. Thanks for inviting me. I'm thrilled to be here. So thank you.
All right. Thanks.